Last week, a 72-year-old woman I know got a scary phone call from her doctor. Her liver numbers looked very high. She could not sleep for 3 nights. She was thinking, what is happening inside my body? Is something seriously wrong? But guess what? Nothing was wrong with her liver. The real problem was this. The day before her blood test, she did heavy gardening, took her daily multivitamin with biotin, and came to the lab without drinking enough water. Her blood test showed danger, but her body was totally fine. And this happens every single day. Big research shows that a lot of abnormal blood tests are actually not real health problems. They are mistakes people make 24 to 48 hours before the test. In this video, I will show you the 10 most common mistakes seniors make before a blood test and how to avoid them. Plus, so your results show the truth about your health. And please stay for mistake number 2. It is a food almost every senior takes, and it can completely change your blood test numbers without you knowing. Chakra. Number 10, playing Russian roulette with your medications and supplements. Here's something most people have no idea about, and it affects about 15% of all blood tests according to research published in the Clinical Chemistry Journal. Your medications and supplements can completely hijack your results. Now, I'm going to tell you about something specific because chances are you or someone you know takes this. Biotin. It's that popular supplement everyone takes for their hair and nails, right? Seems totally harmless. But here's what the Mayo Clinic discovered. Biotin interferes with over 40 different blood tests. We're talking thyroid tests, vitamin D levels, even the cardiac markers they use to diagnose heart attacks. There was a documented case of a woman who was about to be treated for a serious thyroid condition she didn't even have. The only problem? She was taking 10 milligrams of biotin daily for her hair. Now, why does this happen? The labs actually use biotin in the testing process itself. So when you've got extra biotin floating around in your blood, it messes with the whole system. It's like trying to measure something with a broken ruler. The tool itself is compromised. Here's what you need to do, and this is non-negotiable. Stop taking biotin at least 72 hours before any blood test. For vitamin C supplements, which can mess with your glucose and cholesterol readings, stop 24 hours before. Now, prescription medications, that's different. Never, and I mean never, stop your prescription meds without talking to your doctor first. But you absolutely must tell your doctor about everything you're taking. And I mean everything. That fish oil, that multivitamin, that baby aspirin, those herbs your friend recommended, all of it. Even something as simple as taking aspirin for a headache can affect your platelet tests for up to a week. Make yourself a complete list of every pill, capsule, and liquid supplement you take and discuss it with your healthcare provider before you even schedule the test. This one simple step can save you from a world of unnecessary worry. Number 9, ignoring your body's internal clock. Okay, this one blows people's minds because nobody talks about it. Your body isn't the same at 8 a.m. as it is at 3 p.m. And a study from the University of Chicago found that 62% of patients have no idea this matters for blood tests. Think about cortisol, your stress hormone. At 8 in the morning, it can be 50% higher than it is at midnight. So if you get your cortisol tested at 3 in the afternoon instead of first thing in the morning, the results might make it look like you have adrenal insufficiency when your adrenals are working perfectly fine. Testosterone in men? Same story. Morning levels can be 35% higher than evening levels. A study of 5,000 men found that guys tested in the afternoon were twice as likely to be diagnosed with low testosterone compared to those tested in the morning. The morning. High even when their actual hormone production was identical. Think about that. Same person, same hormones, completely different diagnosis just based on time of day. Iron levels swing by about 30%, typically higher in the morning. Even your white blood cell count changes throughout the day, going up about 25% from morning to evening in perfectly healthy people. So here's your game plan. Always schedule your blood tests for the same time of day, especially if you're tracking changes over time. Shoot for morning appointments between 7 and 10 a.m. That's when most of the reference ranges labs use were established. If you're getting hormone tests done, testosterone, cortisol, anything like that, morning testing isn't just recommended, it's essential. If you absolutely can't get a morning appointment, make sure you note the exact time of your blood draw and tell your doctor. They need that information to interpret your results correctly. Some progressive labs are starting to adjust their reference ranges based on collection time, but that's not standard everywhere yet. So the responsibility for timing falls on you. Remember that. Number 8, the exercise trap that catches even fitness enthusiasts. All right, this is where things get really interesting and honestly kind of frustrating. That morning run you did, that gym session before your appointment, you thought you were being healthy, right? You're actually sabotaging your results in ways that can lead to serious misdiagnosis. A comprehensive study from the American College of Sports Medicine in 2023 looked at 1,200 athletes and found that intense exercise within 24 hours of blood collection altered over 30 different blood markers. 30! Let me give you a scary example. Creatine kinase. Doctors use this to detect heart attacks and muscle diseases. After a tough workout, this marker can shoot up by 300% and stay elevated for 72 hours. Imagine getting rushed to the emergency room because they think you're having heart problems when you just did leg day. Liver enzymes, ALT and AST, doctors use these to check your liver health. After exercise, these can spike by 150% and stay high for up to a week after really intense training. There's a documented case from Boston of a triathlete who had an unnecessary liver biopsy because his enzymes were so elevated after training. His liver was completely healthy. And here's the kicker. Even a moderate exercise affects your results significantly. A simple 30-minute jog can increase your white blood cell count by 40%, making doctors think you might have an infection or inflammation. Your blood sugar can spike or crash depending on the type of exercise, completely throwing off diabetes screening. The inflammatory marker CRP can double and stay high for 48 hours. Here's what you need to do. Avoid any vigorous exercise for at least 48 hours before blood tests. Ideally, make it 72 hours if you're getting muscle enzymes or inflammatory markers checked. Light walking is fine. I'm talking about anything that makes you sweat or breathe hard. Now, I know what you're thinking. But I can't skip my workout routine for 3 days. I get it. If you absolutely can't skip it, at least tell your doctor about your exercise timing so they can interpret the results with that context. But honestly, it's worth taking a few rest days to get accurate results. Your health decisions depend on it. And hey, before we go any further, if you're finding this valuable, do me a favor and hit that like button. It helps more people discover this information. And make sure you're subscribed because we drop powerful health content like this every single day. You don't want to miss what's coming next. Number 7, the hidden impact of that innocent glass of wine. Let's talk about something that affects almost everyone: alcohol. Even that single glass of wine you had with dinner 2 nights ago is affecting your blood test results more than you realize. Research from the National Institute on Alcohol Abuse showed that drinking alcohol within 48 hours of blood testing can change liver function tests by up to 40%, triglycerides by 30%, and mess with your blood sugar regulation for days afterward. Here's a fascinating study from 2022. They followed 500 moderate drinkers. We're not talking about heavy drinkers here, just regular people who have a drink or two. When these people abstained from alcohol for just 3 days before testing, their triglyceride levels dropped by an average of 53 points compared to testing after their normal drinking pattern. Let me put that in perspective. That difference alone could be the deciding factor between getting prescribed cholesterol medication or not. That's huge. Alcohol also depletes your B vitamins and magnesium, while artificially bumping up your iron levels. It creates a completely distorted picture of your nutritional status. Here's what's happening in your body. Your liver treats alcohol like a toxin, because it is one. Processing that toxin takes priority over everything else your liver normally does. And your liver keeps producing enzymes to break down that alcohol for up to 72 hours after you stop drinking. Those elevated enzymes show up on your standard liver function tests. Even more concerning, alcohol affects your platelet function and clotting factors for up to 96 hours. That's 4 full days. It could mask bleeding disorders or create false worries about clotting problems. There's this enzyme called GGT. It's a sensitive marker of liver health. After heavy drinking, it can stay elevated for up to 3 weeks. 3 weeks. So here's the absolute best practice. Avoid all alcohol for at least 72 hours before any blood test. If you're getting comprehensive metabolic panels or liver function tests, make it a full week if you can. This includes beer, wine, spirits, and even medications that contain alcohol like some cough syrups. Now, I'm realistic. If complete abstinence isn't doable for you at minimum, and I mean absolute minimum, avoid alcohol for 48 hours before testing, and definitely don't have any heavy drinking sessions within a week of your test. Number 6, the hydration sweet spot nobody talks about. This seems so simple, but your hydration status has a massive impact that most people completely miss. A study from UCLA Medical Center found that patients who were even mildly dehydrated showed false elevations in kidney function markers by an average of 20%. People were getting scared about kidney disease when their kidneys were perfectly fine. Here's what happens when you're dehydrated. Your blood gets more concentrated. It's like when you leave a pot of soup on the stove too long. Everything gets more concentrated, right? Same thing with your blood. Your sodium, potassium, blood urea nitrogen, creatinine, all of these spike with dehydration, making it look like you have kidney problems. Your hemoglobin and hematocrit go up too, which could incorrectly suggest blood disorders like polycythemia. But here's where it gets tricky. Drinking too much water causes problems too. A study of 800 patients found that people who drank more than a liter of water in the hour before testing showed falsely low sodium levels in 35% of cases. Some appeared to have dangerous hyponatremia that would require immediate treatment. The overhydration also diluted protein markers, hormone levels, and blood cell counts. People looked like they had anemia when their red blood cell production was completely normal. So what's the sweet spot? Drink your normal amount of water up until about an hour before the test. Your urine should be pale yellow. Not completely clear, not dark amber. Pale yellow is the goal. Most people need about 16 to 24 ounces of water in the 2 hours before testing. Sip it slowly, don't chug it all at once. Avoid excessive caffeine or alcohol in the 24 hours before because both are diuretics that make you dehydrated. And here's something important. If you're doing fasting blood work, you can and should drink plain water during your fast. That old advice about not drinking anything before blood tests, it's outdated and actually harmful to your results. Water doesn't break your fast and it keeps your hydration where it needs to be. Dear senior friends, let's wrap up today's discussion about the blood test mistakes issue here. We'll continue with the remaining part tomorrow. Stay tuned and wait for me. I'll be back then.